I'm going to go ahead and get us started. I think you hear us talk a lot about a grateful patient or a grateful family program. Today, we wanted to dive a little bit into a specific niche of that and really working to engage physicians, since so many of us are in the healthcare and hospice world. But if you're not, it's okay, because you can insert any other potential front working with your people's organization, whether it be teachers or someone who is connecting with your constituents on a daily basis. So keep that in the back of your mind, even though we're going to be focused talking a little bit more on the medical terminology in this presentation today. So with that, I want to just start with really, okay, what is a grateful family program? Really at its core, it's a program that is taking a proactive and a structured approach at helping to build relationships with and cultivate prospective donors with people who have had a positive experience or been positively impacted by our organization. We know that that makes for a really great opportunity if someone already has said, hello, you are amazing. I can't thank you enough. And we know that the tendency for many people in our professions is to be very humble and say, oh, thanks, just, do my job. It's a pleasure. It's an honor to serve. And then they move on. And so we want to make sure that we put things in place to proactively, as the fundraisers, be able to help our teams, because we can't be everywhere within the organization, to help them to create an environment where they're comfortable and confident connecting us, and that we're building those relationships. And physicians are, of course, at the core of that in any healthcare organization. So with that, on to the next slide, please, Trish. So why would we want to have a grateful patient and family program? We know that it's going to assist in our ability to provide excellent customer service. If we are focused on what is going right instead of what is going wrong, naturally, we're going to be doing a little bit more and building off of that. So it really, really helps support excellent customer service and much more of a positive environment. It enhances our ability to maintain and expand services. If you are constantly getting positive feedback about something that you are doing within your organizations, aren't you going to want to keep doing it? You're going to think twice before maybe cutting that service. And you're also going to think about, how can we maintain this? How can we expand this? So having a structured program in place really can help with that. It helps to think about every relationship made being a potential future donor. We know that we're always looking at that, but if we're able to create an environment within our organizations where more people than just our small development staff, our philanthropy staff, is looking at every potential relationship as an opportunity, not only for some really great recognition and feel good both on both sides of it, but also an opportunity to truly make a transformational impact on your communities through the work you're doing at your organization. That's invaluable, right? So we know that a relationship and positive quality care ultimately can lead to philanthropy and giving. And us as the professionals know how and when to work with a prospective donor and cultivate them and build a relationship and help them find ultimately the place that they're happy and excited. And that's when we can make an ask. But I think sometimes we have a tendency to the other people within our organizations, whether it's the physicians, the nurses, the clinical teams, don't really understand. They don't know what we know, right? They're in a very different profession than they are. They don't know that we are going to look at an opportunity to get to know someone and understand what makes them tick and educate them on what we're doing and help share the vision and the mission for the work before we ask someone for money. So by really building a structured program and empowering them with the tools that they need to recognize an opportunity and to help be a piece of that process, and knowing that that's not a role that they need to make an ask right then and there, but it's how can we further this and move this relationship along, really ultimately can inspire some tremendous giving opportunities. It's an opportunity for us to gather more stories to share both internally and externally. How often, when I talk to people and ask them, what do you say when someone compliments you? They're like, I just deflect, or I feel really good for the moment and then I move on because it's a busy day. What if we are able to take and get a story and celebrate and recognize and make that much bigger? That is powerful both internally for employee morale as well as externally for helping inspire other gifts. So grateful patient programs really help with that. Next slide, please, Trish. While we're trying to look at the positive side of things, the reality is we can also resolve some issues, right? Once in a while, we are able to uncover the fact that someone had a really great experience, but man, they were really disappointed that nobody ever came by to take out the trash. And that was just appalling. They couldn't believe that. But because we're in a place where we can just kind of pass along feedback, we potentially can address something that might have a negative impact on our organizations. We can support patient and family experience initiatives, especially in healthcare today. So many things are related to the perception that the patients and their families have about the experience, right? And so by us being a part of the conversation and helping to focus on the positives, we can truly have an impact on that. We can engage other departments in philanthropy, y'all. We know that it's a lot of work to cultivate, to get to know people, to find those prospective donors and take them through the process. But our opportunity to engage people who clearly are involved with having relationships with those people that they serve can make such an impact. And physicians can be a very powerful person in this process. They are looked at with such respect and leadership within the organization. Their patients very much look at them as their organization. And so they're uniquely positioned as a trusted advisor, and they definitely can help inspire really impactful work. And so by engaging other departments in philanthropy, exponentially our pipeline is expanding beyond just the connectivity of a small philanthropy staff. So moving on into the next slide, I always like to take a look at, if our ultimate objective in fundraising is to find people who maybe both have the ability and the inclination to want to make a gift, we're having to look at look for donors in lots of different places and to focus on expanding our prospect base. Externally, we know that we are engaging our volunteer teams. We are looking for people to help us in various different giving levels. So we're looking for people with an ability to want to do something, with a connection to an individual. But sometimes we're having to educate them on the work that's being done with our organization. So if we take the internal approach and we focus on people who might have an inclination to want to do something to help the hospital or the hospice organization that has positively impacted them and their family, we know that we're already having someone who has that inclination side, that person who already has a really feel good experience. And because we know that philanthropy and giving is very much connected to emotions and the feeling that we have about an organization, that is a huge step in the right direction. So it's when we're able to take those two things and match them together that truly those transformational gifts can come to fruition. So next slide, please, Trish. So just a little more on expanding the culture of philanthropy. We know that if we deploy a consistent and easy to understand messaging that highlights why philanthropy helps further the mission throughout the organization, that there's going to be much more of a willingness by individuals who don't think it's their job to be a part of the philanthropy process to recognize that, wow, this not only helps my patients, it helps the community, it helps me do my work better. And so I should pay attention if there's something small that I can do to be a piece of that on that continuum of the philanthropy process. That is something I could consider. I could feel good about that. So it helps us answer the question, why philanthropy and how does that apply to me? Instead of being in silos where everybody does their own individual job, people become more open-minded to the fact that something they're doing anyway, that's not going to create extra work for them, could help further the work that's being done, and they feel really good about it. And so while the philanthropy team is responsible for the fundraising, making the asks, and getting the actual commitments of revenues, other people in the organization start to understand that philanthropy is going to go beyond just that department, and it really is it's important to the entire organization. So when you have someone like a physician who is, very much connected to their patient, they've touched their life. The patient has expressed gratitude, and the physician, if we have properly trained and educated them on, our project, what we're doing, what a person might be able to do, and let them know, and they're able to have a very organic, natural conversation about, many people feel the way that you do. And if you want to try and help other people have the same positive experience, there's a way you can do that. And I'd love to connect you with our philanthropy department. If we're able to get to that point, it is truly transformational. So the team starts to learn and recognize patients and families who are going to self-identify, who say thank you, who are very positive in expression of gratitude, and start to perform new behaviors like comfortably connecting to the philanthropy team. Hey, would you be willing to share your story? That's amazing. Can I give your phone number to our philanthropy team? Can I have them contact you? That you sure could help us with your story. We'd really love to hear more. So utilizing employees and physicians as not only those connectors but also those cultivators, those people who really can tell the story. And so by expanding the culture of philanthropy, we are naturally leading into the systematic approach to a grateful patient and family program. And with that, I'm going to hand it over to Jake so we can dive a little bit more specifically into those positions as leaders and allies for philanthropy.
Awesome. Thank you, Marty. So that was a lot of the theory, but I know some of you are on today of, how do I begin to set this up, or how do I pilot this in my organization, whether we are clinical, whether we are medical, whether we are not. But the first thing that we know is that the patient facing or the customer facing or the student facing bodies are our best people to interface with our constituency. So looking at just physicians as the healthcare example, first and foremost, they're well positioned to kind of be at the forefront anyways. They have that kind of inherent trust that doctors, that leaders have. So if they buy into this program, and you could pilot it in a department where you trust the department head and have that good relationship, and can talk with several of the people from that specific clinical area, goes a long way in kind of getting everybody else on board. Because if they say, hey, we're endorsing this, the clinical team is all about it, this is going to help us, it's easier to get buy-in and not have to launch it system-wide or organization-wide right away. Small department, starting small. The next is to kind of ask for their help and how to implement it and set it up. If you come in with the full plan and here's how we're going to do it, sometimes they feel like it's being forced, or that they didn't get a say, or that's not the best way to do it, or that's not going to work because of this. But kind of getting the picture of here's what we want to accomplish. We want to have it done by 30 days from now, 60 days from now, whatever it might be. But then getting their input at that point to figure out how to optimize it, how to transfer that information back to you. Is it comment cards? Is it they have something in the system that IT can set up? Is it they call you every other Friday and say, here's the list of people that we have? Lots of different ways to do it. We've seen it optimized several different ways in a bunch of different organizations, but do need to have that conversation with your physician leaders about, what is the most effective way to do that. If you can demonstrate that the end result of the program is benefiting their department or their organization in some way, they are way more likely to have their own buy-in for it. So if you're saying, hey, yes, we're trying to do this program and it results in stories and we're collecting stories and that's kind of the primary purpose, but down the road, we're hoping that these lead to relationships that we can, again, ask for those gifts, which supports and grows your department in the following ways. So if they can see the results and some of the financial benefits from doing this program in the long run, they're a lot more excited about kind of bolstering it and making sure that it supports the organization. They are great often at being able to further promote it within other organizations. We know just from experience, from listening to panels, from going to conferences, that peer-to-peer information, peer-to-peer respect is huge with physicians. And if they have an idea that is from a peer or from a department head or some other clinical leader, patient-facing leader in the organization, they are much more likely to buy in if it's kind of internal clinical staff who are driving that program. So getting your couple of physician champions in place and really getting them inspired to inspire others is going to be much, much more easy for you as the admin person than trying to get to a bunch of physicians and try to get them all to buy in. So if you can just get your one and kind of branch it out from there, it just goes so much quicker and it saves you a lot of time. And the program buy-in tends to be a lot better. When you're talking to physicians, and we know this already, but just as a reminder for those of us who interface with clinical team, the messaging and the communication needs to be short and succinct and frequent. So instead of saying, hey, we're going to have a 2-hour meeting, we're going to talk about this, is saying we're going to block this short window every so often. And we're going to be really, really clear. We're going to prioritize. We're not going to waste your time so that the messaging is very, very clear. We're not dancing around what we're asking from you. So here's exactly what we need from you. Here's how often we'll check in with you. If you have questions, here's how we can support you, and going back and forth. So you're not saying, oh, this is going to be a 2-hour deal or a 3-hour deal that happens every so often. So making sure that their time is being used wisely. And if they feel that, it's just the communication both ways. And I know that we kind of all inherently know this, interfacing with clinical teams, you can't take a lot of their time, but if you use that time really wisely, make it short amounts, and then spread them out at even intervals, we found that we get a lot better connection in that way. Next slide, please. So I have the next 3 slides are the quick and easy presentation that we use when we're orienting the kind of physician pilot staff typically. So if we're implementing a Grateful Family program. And again, this is a whole 9.5-hour academy. They go into way more detail here. And obviously doing it in person is the easiest way to do it. But to kind of boil it down and give you some of the key points that we say, okay, we have this doctor, we have this physician leader who we know is bought in. They don't really know what they're being asked to do yet. So this is the information that we're giving them right off the bat. Next 3 slides. So first thing, saying, hey, if someone has a good experience and they're demonstrating, as Marty mentioned, hey, there's something that I really like to do, or is there anything that you need? Or when they're asking questions like that, that's their willingness to become involved. And it's so easy to dismiss them and say, no, that's our job. It's what we do. Of course, we don't need that. We kind of deflect the compliment, as Marty mentioned. But when they say things like that, we need you to say, yeah, actually, if I could connect you to the foundation, we're collecting stories right now. We'd love to have your participation in something. So being able to kind of reflect that back and say, hey, here's some of the audio cues to listen for. But when they have a good experience and they're telling you about it, they usually are willing to do something and help us further our mission. So just make sure you catch those cues and kind of funnel them this way. Physicians are kind of in a good position if they know the general basis of the program, to explain. Again, you have that kind of inherent trust with your frontline caregivers. Someone says, okay, if my doctor's talking about it, that probably makes sense. I understand, and I can listen. If they want me to do this is the steps that I'll follow. So they're well positioned to have that connection right off the bat. And just to kind of arm them with a little bit of information. Again, we're not asking them to go too far down the process. We want it as quickly as we can. Can they volunteer their information to the development, to the fundraising team, to the foundation, whomever? But as people are asking these questions, just to let your physicians know that they're thinking, is this project that they're working on one that's relevant to me? Do they even need the contribution? They may ask the doctor, do y'all even need money? It looks like this wing is beautiful. Yes, but we're actually working on this thing or a different hospice home or something else elsewhere. And that is related to what we're doing. And what are some of the results that I could see if I were to be able to donate, be able to give a transformational gift? None of these things they have to know exactly. They don't have to be full answers, but they need to be a little bit prepared for these kind of questions and have kind of their boilerplate. Hey, you may get this. And the answer may be, that's a great question. I'll refer you to our development team, our foundation. They'll be able to tell you all about what we're trying to do in the next 3 years, but just so they're not caught off guard. So when they say, hey, I'd like to do something, and say, hey, can I connect you with the foundation? There's not zero information after that. They're able to go a little bit further. Next slide. The next thing we try to talk to our physicians about is being very specific on what we need them to do. They say, okay, this sounds great. It seems like this is going to be financially beneficial for all of us. What exactly are you asking me as the department head to do here? And we're saying, hey, we're asking for your help in the specific and following ways. The first is to encourage your staff and peers and colleagues and other departments to begin implementing this program, to begin listening for those audio cues and kind of pushing those stories gently to the foundation. The next is to kind of be our champion for the program. Be excited about it. Make sure that your peers and the people who work for you know that you endorse this program, both within the organization and within your communities as well. The next is when you hear those audio cues from the patient or the family or whoever is grateful for those services that your nonprofit has provided, to be able to say, actually, yeah, if you're have a story to tell, if you don't mind, can I put you in touch with the development department? They're actually collecting stories for our website right now, or whatever the message is, but something that kind of pushes them towards your team so you can begin to work with that donor. The next is to share your experiences, saying, hey, I had this really cool story, this really cool thing that happened. Can I tell you about this one patient that we had came in and did this, and they said they wanted to connect, but for them to share their own stories as the clinical team. And then lastly, referring selected patients prior to admission for development visits. This is a little more on the mature side of a Grateful Family program. Some larger organizations and even medium size will have like a Friends of the Foundation. So if someone is a donor and they say, yes, I would like the foundation team to know when I'm admitted to the hospital. Of course, they're not going to get special care. They're not going to get, additional services. But it might be the case that you as the development professional get an email when one of your donors is admitted, or if one of your donors' family members is admitted, and they check a box that says, yes, it is okay for you to come visit me. And you can have a little gift bag ready with like extra long power cables, some blankets, maybe some chapstick, just kind of things that you don't think of that you necessarily need, but it's a really nice way to come by and say, hey, Mr. Lyons, I realized that you fell and broke your arm, and I hope you're doing well. I heard you were in the ER. I just wanted to come by and say, hey, and give this little basket. We're really appreciative that you chose us for your services. If there's anything you need, here's my card. Please call and let me know. So those little touches after they've given a gift to kind of further that relationship. So that's, again, kind of phase 2 level of expansion, but something that we've seen work really well as a relationship builder for our long-term donors. And lastly, next slide, please. The most important thing to communicate to your clinical team or the patient facing or whomever is we are not asking you to ask for money, especially for patients at bedside. This is the first question we get all the time. It is the most important thing we want them to walk away knowing is no, we are not soliciting anyone while they're under care. What we want to do is connect to the development team down the road if they are interested. And we have to be really careful with HIPAA. We have to be really careful with ethics. But if we can go in from the beginning and saying, here is how we're going to gently handle this. And this is exactly what we will never ask you to do. This is not part of this program. There's tons of national organizations that have pilot programs and ways to do this. None of them recommend that we do this. I just want to be really clear up front. We're not asking you to be a fundraiser. We're just looking you to identify people who have had a good experience with our organization and might want to become part of our mission with some sort of a thank you, big or small. That's it. And here's the process on how we set it up. So as long as we can communicate this very, very clearly, and we usually put it at the beginning and the end of the presentation of like, just a reminder, we are not asking you to ask for money. So that was a lot of information. And again, I know the Grateful Family program is a 9.5-hour academy on its own, but I'm going to turn it back over to Marty just for some key takeaways, and then we'll go into any questions because I'm guessing there probably will be some.
Thank you, Jake. Yes, we just kind of wanted to recap our biggest takeaways on some keys to getting your physicians engaged with your Grateful Family program is involve them in the process from the beginning. You do not want to go through your process, talk to, some clinical staff, talk to everyone in the organizations, and forget about talking to your physicians. They will not like that. Definitely need to talk to them early on in the process. We want to ask for their advice and suggestions for implementation. If you have a this or that, what do you think is going to work better? How can we make this so it is easy for you? It is not our goal to create yet another thing for anyone within the organization. We know that you are understaffed. Everyone already has too much to do. What we are looking for is to dovetail into something that you are doing anyway and having it really easy for you to report back on, here's someone I want to connect you with. Is that a paper? Is that a electronic communication? How can we do this in a way that's going to be easy and not going to take away from what you're doing? That's important. They know how they work, and they know what's going to work well for them. So getting their advice and their suggestions for how to best implement it is absolutely key. Listening to their perspectives and responding as appropriate. Hearing whatever their objections may be, because you might have some of this, like, that's never going to work, I don't know about that. And we want to hear what it is that they are concerned about, so that we can obviously respond as appropriate, but make sure that they get comfortable and confident in what their role is. Communicate succinct, powerful, and continual communication. I think that's one of the things is we oftentimes say, hey, we're going to do this, we're going to communicate, we do it, we get up and running, and we forget to check back in. We forget to do things like recognize when they make a connection that led to a positive result. We forget to celebrate a success. We got to celebrate small wins along the way. And if it's, hey, I talked to this person and they said that, so-and-so did an amazing job, I want to recognize and acknowledge that. And if somehow, somewhere down the line, someone makes a gift because of that, we've got to connect those dots and celebrate that as well. So again, lots of information for a short period of time, but I see we already have some questions in the chat. So I'd like to go ahead and take a look at those. And let's see. Oh, shoot, I have too many.
I think it was mostly getting some people logged on. I think we're all caught
Oh,
up.
okay. There was no questions?
Not from this
people
chat.
having to go. Okay. All right, no worries. Well, with that, then we will open it up for questions. So feel free, since we're kind of at this point, to unmute yourself to ask a question. Anyone have questions? Wow, Jake, that was awesome. We covered everything.
We covered 10 hours of content in 20 minutes and nailed it.
Hey, this is Susan Bennett from Cornerstone, and I have a question.
Yes, Susan.
Hey, Marty, if the physician is not a donor in the employee giving program, is that an uncomfortable thing, or do you ask them if they want to become part of that, or do you not bring it up at all? How do you handle that?
Great question, Susan. Of course, we always love if they are fully engaged in supporting. So I think there's varying degrees of involvement already, right, on your relationship with your physicians. I think when you're looking at where should we pilot this, it's a great idea to look to people who are already supporting your cause. So if they are already donating as a physician, they're a great person to start with on talking to, but also people who are already receiving lots of compliments, if you're aware of that, are also great places to start. But if you find that there is someone who is not a donor, you don't want to not involve them just because of that, but hopefully by your building the relationship and engaging them in the process, that eventually at some point it may be appropriate to ask them to consider getting involved as well. So I hope that answers your question at least somewhat. There's no one.
It helps. It helps. Thank you.
And Susan, if it helps, additionally, just for some numbers, if you're at like 20 to 30% of your physicians giving, that's great. That's way above the national average. But if you have a very mature, grateful family program, you want like over 90% of your clinical team trained and involved. And that's considered good. So the eventual hope, if you max out both, you're going to have a lot more people who are good champions for kind of collecting those stories and bringing them to the development team than you are going to have donors. And that's just kind of how it is, unfortunately.
Yeah. Makes sense. Okay. Thank you very much.
Yes. Thank you, Susan. Other questions?
Yeah, I have one, Marty.
Yes.
Hey, question for you. What is the definitive source on the ethical and legal responsibilities of reaching out to patients with solicitation for gifts?
So HIPAA is pretty clear on that. And the way that we don't get mixed up in that whatsoever is that when a clinical person or the patient facing or the family facing person says, hey, can I tell your story? For them to collect their information and check a box that says, I consent to having the foundation reach out to me using the following contact information. So they have given us their info outside of being a patient or a family who's had an experience with your program, so that there's no HIPAA implications at all. So instead of trying to like do the right thing and check all the boxes and make sure we're adhering to the legal codes, we're saying we're going outside of this. This is just a person in the community now who has volunteered their information willingly and signed it and said, here's my name and address and phone number. Yes, you may reach out, so that we're not rolling the dice on messing with HIPAA at all. That's generally what we try to do.
Okay, I mean, I was mainly looking at it from like an annual gift standpoint,
Sure.
like as far as just, I mean, going to do a blanket mailer, that kind of thing.
So you're saying as you're collecting, like, can you use patient data as far as your mailings for things?
Yeah, like nondescript patient identifiers, just addresses.
Yes, that gets a little more complicated, obviously. The general rule is if we try to have something in the discharge packet, that's generally a little easier and safer, just informational stuff. Hey, did you have a great experience? Here's how you can contact, here's how you can tell us, because you can't, as a separate 501c3 or a foundation, say, hey, here's a list of people who've had an experience with our organization, and we're going to send them a mailer. And hey, we know we had this, this, and this. So you get sent to some little bit of ethical gray area and legal gray area there.
Right.
So in putting some kind of collateral in the discharge packet is one way to do it. But the best and easiest way is to have those auditory cues start a conversation with one of the patient or family facing staff.
Gotcha. Thank you.
Absolutely.
Yes. JR, did you have a question? I think I saw you put your hand up. You're muted. Are you talking? There you go.
Yes, I'm sorry, I was a little bit late getting online, but so the whole process of announcing, promoting, or engaging, I got the part about starting it somewhere in a pilot process with folks that are, really engaged and are promoting such. But how do you really bring the whole organization on board, or do you, to talk about the grateful patient?
I can answer that. So you kind of start, I know Marty will be able to expand on this because she's had experience in a couple different spots, but it is department by department systematically over the course of about 6 months typically. And for an organization your size, maybe closer to 8 to 10 months probably. So you want to pick first a department that has high patient outcome scores, because statistically you're going to get slightly better patients who are more excited. They go into the organization, they come out feeling like cardiac rehab, perfect one. You feel like they saved their life. They're going to have a very, very positive, most of the time, compared to some of the other departments, high outcome scores just based on their experience in and out. So you pilot in kind of like on easy mode in one of the most comfortable departments. And then you kind of say, here are the various areas that we want to get to. We're going to take 8 months and do it 1 or 2 departments a month, or however many that you need to do, and to have in-person trainings with their head or the head of the clinical team for each of those places. And it might be the case that you say, hey, for these certain areas, it's just not going to be appropriate for us to ever do this. And we're going to have it in 70%. And that's still a lot of people. And that's still a lot of stories and a lot of new donors. And we're going to call it good. And that is fine. But I know Marty may have some other additional thoughts on that as well.
Yeah, and just to kind of expand on that, it's such a case-by-case thing as well, right? Where you have some really shining stars within your organization who maybe have already been recognized as, an employee of the month, or various different recognitions. Having small individual conversations with people who will be like excited about it, or people who are leaders, is also helpful. So it's looking at the service lines, looking at the individuals you have, and looking at any other initiatives you already have going on is the starting point. I think the other thing that's important to note is that when you're when you're moving out of the pilot area, you have to engage the people who have already been a part of the success of it so that you have that peer-to-peer factor.
Thank you.
I hope that helps. Yes.
And JR, this is Patty. Just one of the things, just to add to you as a CEO's perspective, in a hospital of your size, if you had, since we're specifically talking about physicians today, if you had 6 to 10 physicians who embrace this, that would be great. That would be a successful program, because you're never going to have all the employees or all the physicians embrace this concept. And so, as Marty mentioned, and Jake, just some shining stars. Start with the pilot program. There's going to be some back and forth, and as you figure out what is the best way to do that, because there's so many different ways we can implement this. And so we work directly with the clients, very, very closely on that pilot, and say, okay, here's what tends to work in this system. But understanding it's not going to be a universal, all the physicians or all the employees are ever going to say, yes, I'm so on board on this. You just need a few. If you have a few, the others will start to watch the attention that they're getting, because you're making a big deal about this patient connected and to this person. Then we receive this gift. It may have been 6 months or a year later. And so they start to say, well, wow, I get a lot of compliments too. Why aren't they, why am I not getting acknowledged? And so it takes a while to build that up. And so, if you don't implement it ever system-wide, it's not a failure, because you only need small numbers of physicians and employees to engage on this, and you can be very, very successful with those numbers. And it'll grow gradually over time. It grows organically.
Thank you.
Great questions, y'all. Any additional questions for us today?